Today we're going to be removing an indwelling Foley catheter. So the first thing you would want to do would be to confirm your order, and you would want to gather your supplies. So the supplies needed for removing an indwelling catheter are you will need a syringe, and you will need to look and see how much liquid is in your balloon on your catheter to know how much of a syringe you need. Then you also will need a waterproof pad, a pair of clean gloves, and a red biohazard bag. So we enter our room. Hello, Miss Long. My name is Brittany. I'm your nurse today, and the doctor has ordered for us to take your catheter out. You're going to be going home, and he wants you to see if you can empty your bladder on your own without your catheter. So if there's any questions, we'll get started. Okay, so before any patient contact, make sure we wash your hands, and we will raise our bed rails, and I would raise the one on the falling side, and raise our bed to a good level for body mechanics. Alright. Now the first thing we would want to do, might also add this to the list of items needed, we would want to empty our catheter bag if it's not already been emptied. Of course, you would take a graduate, empty your catheter bag. That keeps it from pulling on the bladder as we go to remove it. So at this point then I would empty the urine bag. Also, you would want to make sure you had on gloves before you did that, and then we'll be able to take out the catheter. So we will lower the bed rail on the side we're working. And go ahead and place the pad. And I'm going to go ahead and put my gloves on. Place this waterproof pad just to protect our bed. So I would ask the patient to raise her hips, and I would place the pad underneath her buttocks. Okay, so my catheter says it's a 10 ml inflation, so I should get out around 10 mLs of saline. Also, I'm going to take my red biohazard bag, and I would either have that at the foot of my bed, or I'm just going to go ahead and line my trash can with that bag so I can put it in there when I'm finished. Now I'm going to move that close to my bed. Alright, so I'm going to also remove the tape, or the whatever may be holding the catheter, securing it. I will attach the end of my syringe to this port, and usually it's going to automatically start pulling back the fluid, so just slowly remove the fluid from the balloon. And if you pull back and it gives you resistance, then that pretty much means that that's got all the liquid out. So I can remove the syringe, or I can leave it attached, either way. Then you want to tell your patient just to relax, and as you are taking out the catheter, you want to just make sure you do that in one smooth motion. And you also would want to explain to your patient that this is going to be a lot less intense than going in. Okay? Okay, so I've got my balloon, I've got all the liquid out of my balloon, it's deflated. So on the count of 3, Miss Long, I'm going to take your catheter out. So just relax, take a deep breath. 1, 2, 3. Okay, and I can wrap this up just to keep it from flopping in my glove. And I'll take all of this and dispose of this into my red bag. Okay, also at this point, we could do pericare just to make sure that the area is clean. And then I would remove my waterproof pad. Place that in the dirty linens. I would remove my gloves. Cover her back up. And I will assist her to a comfortable position. Raise my rail. Lower my bed. Okay, lower my rails. Make sure she has her call out in reach. Make sure she doesn't need anything. And then I would wash my hands, and then I would document the procedure, and of course making sure to record the output that I emptied from the catheter.